Hello, I am Dr. Bipin from Care Hospitals, Hyderabad, South India. We will be talking about diabetes today. I think about managing diabetes, what is required is not just a physician's knowledge or a physician's prescription. For diabetes management to occur, it has to be a greater movement, involvement not just of the patients, of their families, but also society in trying to acknowledge that this is a very serious disorder. It is manageable, not to stigmatize people, but to help them come to targets, not to cajole them to break the rules once in a while that nothing will happen, let's eat something, but to help them, handhold them, and leading to a healthier individual. As a person who is suffering from diabetes, what I meant was that this would help a person who has developed diabetes, unfortunately, to live comfortably, without ridicule, without stigmatization. And it has to be a movement by the society, by individuals, and by healthcare professionals. If you want to mitigate the disease, we want to prevent the disease from occurring, it requires huge involvement, not from people who have knowledge about managing diabetes, but also about people who are into managing the behavior of people, their attitudes about food, their attitudes about exercise, and each individual is responsible for creating his or her own healthy environment and trying to influence other people also to follow those healthy patterns. Diabetes is a disease of lifestyle. It is a serious disease that limits the lifespan of individual. It's a disease that decreases the quality of life of a person. It makes that person's life different from the other people. If these people have to be helped, we have to prevent diabetes from occurring. And if we have to prevent diabetes from occurring, we have to change our lifestyles. And together, each one of us can contribute towards changing lifestyles into healthier lifestyle, be it food, be it exercise, be it helping people come to terms with the need of implementing these changes. I think this is very, very important. Treating the disease is not important, preventing the disease is important, and together the society, healthcare professionals can do a lot in preventing the disease, managing it better, and preventing or postponing the complications. And if somebody unfortunately develops that, managing those complications. We do not have the kind of infrastructure that is required to maintain the end stage diabetic patients in terms of dialysis, in terms of the myocardial infarction related problems, heart failures. We do not have that kind of resources, and all these can be certainly reduced if we have done a lot for the prevention. So I think one should take steps to improve the lifestyle of the community, starting with our own selves, our own children, our own environment, and that would go a very long way in preventing the disease from happening. Once it is prevented, the rest of the steps will follow. Diabetes is one of the commonest metabolic disorders which is prevalent in the world. Our country is not far behind the rest of the world in terms of having diabetes. In fact, we are number 2 at this point of time in terms of prevalence of diabetes. Diabetes is about numbers, but as we go by, we would realize not that a particular number is important, but it's also important about the number of times you eat more, the number of times you exercise, the number of times you do not do things which you are supposed to do properly, number of times you drink alcohol, number of times you smoke. All these are also important. So the numbers in diabetes are relevant in many areas. Diabetes, as we understand, is a disorder that results from improper availability of a hormone called insulin. And when this insulin is not there, then you get many problems in the metabolism, the fat metabolism, the protein metabolism. But what is often measured and is more evident is the carbohydrate metabolism, and this disease is diagnosed by elevation in the blood sugars or the blood glucose, as we call it more specifically. In people who are not having any symptoms, then fasting plasma glucose more than 126 milligrams per deciliter, HbA1c more than 6.5%, or a post 75 gram glucose estimation more than 200 milligrams per deciliter on 2 different occasions is considered diagnostic of diabetes. If you have plasma glucose elevation more than 126 or a plasma glucose more than 200 milligrams per deciliter after a glucose load and an HbA1c more than 6.5 on one particular day, then that is enough to say that person is diabetic even if he is asymptomatic. If only one of these measures is there, then you have to have it on 2 different days. In a symptomatic individual, however, a random plasma glucose or a casual plasma glucose value more than 200 milligrams per deciliter is diagnostic. Now, why this differentiation between asymptomatic and symptomatic people? We do not want that a symptomatic person should be denied diagnosis and there should be no inordinate delay in initiating treatment in a person who has symptoms of weight loss, excessive thirst, excessive urination. Whereas in an asymptomatic person, we do not want to label someone diabetic with what might be a rare laboratory error. So the idea of having 2 different sets of criteria, so to say, that you have to prove it with certainty in asymptomatic individuals and you should not delay treatment in symptomatic individuals is the underlying difference or underlying parameter that we have considered for labeling this